If you've been struggling with heel pain, especially when getting out of bed in the morning or after periods of rest, you're definitely not alone. Heel pain is an extremely common problem and one of the most frequent foot symptoms people experience. Many patients assume it's simply plantar fasciitis, while others worry it could be arthritis or an inflammatory condition. In reality, there are several different causes of heel pain, and understanding the pattern of symptoms can provide extremely important clues. In this video, I'm going to explain the most common causes of heel pain, the difference between mechanical and inflammatory heel pain, when heel pain may suggest arthritis or autoimmune disease, and when you should consider seeking medical advice. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with one of the most common causes of heel pain overall, and that is plantar fasciitis. Plantar fasciitis occurs when the thick band of tissue underneath the foot called plantar fascia becomes irritated or overloaded. The plantar fascia helps support the arch of the foot and absorbs stress during walking and standing. When excessive strain develops, inflammation and micro damage can occur where the fascia attaches near the heel bone. One of the classic symptoms of plantar fasciitis is pain with the first few steps in the morning. Patients often describe sharp pain underneath the heel when getting out of bed. Interestingly, the pain may improve slightly after walking around for a few minutes before worsening again later in the day after prolonged standing or activity. This pattern is very typical of mechanical heel pain. Now, several factors can increase the risk of plantar fasciitis. These include prolonged standing, increased physical activity, weight gain, poor footwear, flat feet, tight calf muscles, and occupations involving long periods on the feet. Runners and physically active individuals are also commonly affected. Now, although plantar fasciitis is extremely common, not all heel pain is mechanical. In rheumatology, we pay close attention to inflammatory heel pain because this may sometimes suggest inflammatory arthritis or autoimmune disease. One of the key areas where inflammation can occur is the enthesis, which is the point where tendons and ligaments attach to bone. Inflammation at these attachment sites is called enthesitis. Enthesitis is particularly associated with conditions such as psoriatic arthritis and ankylosing spondylitis, which are forms of inflammatory arthritis known as spondyloarthritis. Patients with inflammatory heel pain may experience pain around the Achilles tendon insertion at the back of the heel or underneath the heel where the plantar fascia attaches. Unlike simple mechanical plantar fasciitis, inflammatory heel pain is often associated with prolonged morning stiffness, fatigue, back pain, swollen joints, psoriasis, or other inflammatory symptoms. Now, one important difference is how symptoms behave. Mechanical heel pain often worsens with excessive activity and improves with rest. Inflammatory heel pain may actually feel worse after periods of inactivity and improve somewhat once movement begins. Patients with inflammatory arthritis often describe stiffness and pain first thing in the morning that gradually loosens as they start moving around. Another important clue is where the symptoms occur elsewhere in the body. For example, patients with psoriatic arthritis may also have psoriasis, nail changes, swollen fingers or toes, or tendon pain elsewhere. Patients with ankylosing spondylitis may have inflammatory lower back pain, stiffness, or pain waking them during the night. Now, another important cause of heel pain is Achilles tendinopathy. The Achilles tendon attaches the calf muscles to the heel bone, and overuse or degeneration can lead to pain, stiffness, and swelling around the back of the heel. Athletes, runners, and active individuals commonly experience this problem. Symptoms are often worse with walking, running, or climbing stairs. Sometimes the tendon itself becomes thickened or tender. Now, another condition we occasionally see is retrocalcaneal bursitis. A bursa is a small fluid-filled sac that helps reduce friction around tendons and joints. Inflammation of the bursa near the Achilles tendon can cause swelling and pain at the back of the heel. This may occur due to overuse, footwear irritation, or inflammatory arthritis. Now, let's briefly discuss gout, because gout can sometimes affect the feet and heels as well. Gout occurs when uric acid crystals accumulate within joints or surrounding tissues and trigger intense inflammation. Although the big toe is the classic site, gout can also affect the midfoot, ankle, and occasionally structures around the heel. Gout attacks typically develop suddenly with severe pain, redness, warmth, and swelling. Another important point is that heel pain is not always caused directly by the heel itself. Sometimes pain may actually originate from nerve irritation, referred pain, or biomechanical issues elsewhere in the foot or lower limb. Tight calf muscles, altered walking patterns, and footwear problems can all contribute to ongoing heel pain. Now, many patients ask whether imaging is needed. In some cases, imaging can be very helpful. Ultrasound can identify plantar fascia thickening, tendon inflammation, bursitis, or enthesitis. MRI scans may sometimes detect inflammatory changes not visible on standard X-rays. X-rays themselves may occasionally show heel spurs, although heel spurs do not always directly correlate with pain severity. Another important question patients ask is when heel pain should be taken seriously. It's worth seeking medical advice if heel pain persists for several weeks, significantly affects walking or daily activities, or is associated with swelling, prolonged morning stiffness, inflammatory back pain, psoriasis, fatigue, or multiple painful areas. Symptoms waking you during the night or rapidly worsening symptoms should also be assessed properly. Now let's talk briefly about treatment. The treatment depends entirely on the underlying cause. For plantar fasciitis, management often includes stretching exercises, calf stretches, physiotherapy, supportive footwear, orthotics, activity modification, and occasionally injections. Weight management and avoiding prolonged standing may also help. Inflammatory heel pain associated with autoimmune disease is different because the underlying immune inflammation often requires proper rheumatological treatment. This may involve anti-inflammatory medications, biologic therapies, or disease-modifying treatments, depending on the specific condition. Simply treating the heel alone may not address the underlying inflammatory process. Another important message is that early recognition matters. Patients with inflammatory arthritis are sometimes misdiagnosed with simple mechanical problems for long periods before the true inflammatory cause becomes recognized. This is particularly true in early psoriatic arthritis and ankylosing spondylitis, where heel pain or tendon pain may actually be one of the first symptoms. Now, another thing patients often ask is whether exercise helps or worsens heel pain. The answer depends on the cause. Excessive high-impact exercise may worsen mechanical plantar fasciitis or Achilles tendinopathy, particularly without proper recovery. However, completely avoiding movement is usually not ideal either. Gentle stretching, strengthening, and guided physiotherapy are often very beneficial. Now let's summarize the key messages. Heel pain is extremely common, but the pattern of symptoms matters enormously. Plantar fasciitis is one of the most common causes and typically causes pain with the first steps in the morning that may worsen again later after activity. Inflammatory heel pain associated with psoriatic arthritis or ankylosing spondylitis often involves prolonged stiffness, enthesitis, fatigue, or other inflammatory symptoms. Achilles tendinopathy, bursitis, gout, and biomechanical problems are also important causes of heel pain. Most importantly, persistent or unexplained heel pain should not simply be ignored, particularly if inflammatory symptoms are also present. If you found this video helpful, please make sure to subscribe for more content on autoimmune disease, arthritis, inflammation, and joint health. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.